everybody. So, euthanasia comes from the Greek words eu, which means good, and thanatosis, which means death. And it means good death, or gentle and easy death. This word has come to be used for mercy killing. It is the act or practice of ending a life of a person either by lethal injection or suspension of medical treatment. The word euthanasia was first used in a medical context by Francis Bacon in the 17th century to refer to an easy, painless, happy death during which it was a physician's responsibility to alleviate the physical sufferings of the body. Some types of euthanasia are active, passive, voluntary, involuntary, indirect, and assisted suicide. Active euthanasia is when death is brought by an act. For example, taking high dosage of drugs, overdosing. And passive euthanasia is when death is brought by an omission. Like when someone lets the person die by either withdrawing or withholding treatment. When you withdraw treatment, you are switching off a machine that keeps that person alive. When you withhold treatment, like for example, not carrying out a surgery that would extend the life of the patient for at least a short time. Voluntary euthanasia is committed with the willing or autonomous cooperation of the subject. This means that the subject is free from direct or indirect pressure from others. Non-voluntary euthanasia occurs when the patient is unconscious or unable to make a meaningful choice between living and dying, and an appropriate person takes that decision for him or her. Which would be like if a person ended up in a coma and on life support, they wouldn't be able to make a decision to get euthanized, so someone close and very important to them would make that decision for them. This is usually called murder, but it is possible to imagine cases where the killing would count as a favor for the patient. Indirect euthanasia means providing treatment, mainly to reduce pain, that has a side effect of shortening the patient's life. Assisted suicide usually refers to cases where the persons who are going to die need help to kill themselves and ask for it. It may be something as simple as getting drugs for the person and putting those drugs within their reach. It is believed that euthanasia started in ancient Greece and Rome around the 5th century BC. Some did this by abortions and every now and then performed a mercy killing, even though doctors were supposed to follow the Hippocratic Oath, which is, I will give no deadly medicine to anyone if asked, nor suggest any such counsel. During the Middle Ages, euthanasia was pretty much out of the question. If one committed suicide, the law in Europe was for the body to be dragged through the streets or nailed to a barrel and left to drift downriver. During the 17th and 18th centuries, euthanasia was a topic of discussion. However, people continued to reject euthanasia and assisted suicide. Between 1478 and 1535, Sir Thomas More is often quoted as being the first prominent Christian to recommend euthanasia in his book Utopia, where the utopian priests encouraged euthanasia when a patient was terminally ill and suffering pain. In 1828, the first law against assisted killing, known as anti-euthanasia, was passed in New York. In 1870, the use of morphine and analgesic medications for assisting quick and painless death was suggested. In 1885, the American Medical Association strongly denied the use of analgesic for euthanasia. In 1994, Netherlands was the first country where euthanasia was allowed. 2001, the euthanasia law was adopted in Belgium. And in 2008, U.S. state of Washington legalized assisted suicide. In Europe, euthanasia is only legal in the Netherlands and Belgium, provided certain conditions are met. For example, the patient's request must be voluntary and well considered. The patient must be suffering unbearable physical or mental suffering. With no prospect of relief, the patients must be informed about their situation and prospects, At least one another independent doctor must be consulted. In Belgium, euthanasia is only allowed if the patient is an adult. However, in the Netherlands, euthanasia is allowed for children aged between 12 and 16 years of age, with the consent of their parents and guardians, and for individuals aged 16 and older, it's up to them. Assisted suicide is legal in the Netherlands, Switzerland, and the state of Oregon in the US, but have certain conditions like the patient must be considered competent and aware of their situation before doing the assisted suicide. In Japan, only passive euthanasia is permitted for patients who have been in a coma for more than 3 months. While in Egypt or in Islamic countries, in general, the popular Egyptian scholar Sheikh recently issued a fatwa, equating euthanasia with murder but allowing the withholding of treatment that is deemed useless. Those in favor of euthanasia argue that a civilized society should allow people to die in dignity and without pain. They add that as suicide is not a crime, euthanasia should not be a crime. Most religions disapprove of euthanasia for a number of reasons. 1. God has forbidden it, as in the 10 Commandments says, "Thou shalt not kill." 2. Human life is sacred. 3. Human beings are made in God's image. 4. God gives people life, so only God has the right to take it away. Muslims are against euthanasia. They believe that all human life is sacred because it is given by Allah, and that Allah chooses how long each person will live. Christians are mostly against euthanasia. The arguments are usually based on the beliefs that life is given by God and that human beings are made in God's image. Jewish medical ethics have become divided over euthanasia and end-of-life treatment since the 1970s. Generally, Jewish thinkers oppose voluntary euthanasia, often vigorously, though there is some backing for voluntary passive euthanasia in limited circumstances. In Japan, where the dominant religion is Shinto, 69% of the religious organizations agree with the act of voluntary passive euthanasia. In Shinto, the prolongation of life using artificial means is a disgraceful act against life. An important value of Buddhism teaching is compassion. Compassion is used by some Buddhists as a justification for euthanasia because a person's suffering is relieved of pain. However, it is still immoral to embark on any course of action whose aim is to destroy human life, irrespective of the quality of the individual's motive. Some of the cases that had to do with euthanasia were, for example, Craig Ort was 59, was a retired college professor who was diagnosed with motor neuron disease, MND, a neurodegenerative kind that affects the nervous system and could lead to difficulty in gripping, walking, swallowing, speaking, and breathing. He decided to end his life rather than spend the rest of his life in a living tomb. Since euthanasia is still legal in Britain, he traveled to Switzerland to die assisted by the De Genetics Clinic in Zurich in September 2006. He was already 5 months paralyzed prior to his televised death. His last moments was shown on the Sky Real Lives channel live. He first said goodbye to his wife, drank the poison, asked for an apple juice, requested for Beethoven Symphony No. 9, said thank you, and died peacefully. So, in conclusion, the practice of intentionally ending a life in order to relieve pain and suffering is what euthanasia is defined as. It's not possible to regulate euthanasia within the rules. Mostly Islam, Christianity, Judaism, Shinto, and Buddhism are against euthanasia. And euthanasia in Egypt is forbidden on humans, but it is applied on street dogs. I want to know what your opinion on euthanasia is. In certain cases, I am for euthanasia because if they're in really bad pain and they, like that one case said that they're like paralyzed and they they're just breathing and just staring at the ceiling the whole day, then I would suggest that. But for most cases, I am against euthanasia just because my religion, it is a sin to basically kill oneself or others, and in reality it's just mostly up to the circumstance that one person is, because if I were like that person, I wouldn't want to just live my life away, not actually living, just breathing, not being able to move, speak, swallow, anything. And I would rather get euthanized than continue living that life that isn't really a life. So I believe that it isn't right, but other people's opinion might affect that, and it's just do your research and see what you're leaning more towards too. But I think it shouldn't be legalized in a lot of the countries, because only out of 196 countries, only like 8 of them have legalized euthanasia. Thank you for watching.